aside from my interest in looking at combinations of local and systemic therapy in the management of metastatic disease, one of the other things that I'm very interested in, and my research group is very interested, is in studying cancer cachexia. So cachexia, or pretreatment weight loss, is a wasting syndrome. It's associated with about out of every three advanced non-small cell lung cancer patients. And it's a syndrome in which you see patients lose their appetite, lose weight because they have a reduction in their adipose and muscle masses. And so why is that even an important consideration? It's an important consideration because independent of how they do and respond to tumors, how their tumors respond to therapy, if you have this wasting syndrome, you will have half the survival of another patient who has the same stage of disease, the same type of cancer, non-small cell lung cancer, but then who doesn't have that weight loss. So weight loss in and around the time of therapy and at diagnosis are very important characteristics and are associated with poor outcomes and poor survival. So what we did is we tried to answer a very traditional question. And the traditional question in this field is that if we were able to successfully kill the cancer or treat the cancer itself, would we be able to limit the weight loss and these survival decrements that are associated with the weight loss in non-small cell lung cancer patients? And the gist of the data, surprisingly, was that even with radiation given to the tumor, either primary metastatic sites of disease, either in a curative fashion or in a palliative fashion, and independent of stage, it did not change the trajectory, the reduced trajectory and survival that was caused by the patient initially having weight loss. So it seems like the weight loss had imprinted a bad prognostic set of conditions in that patient. And so even if we did treat the patient's tumor, we were not able to reverse the ill effects of the presence of the weight loss on their survival. So what that means is that in the future, when we think about treating patients with cancer and cachexia, this wasting syndrome, we need to have therapies that are tumor-directed, and we probably honestly need to have therapies that are host-directed, meaning therapies that help reduce the likelihood of a person having muscle wasting, fat wasting, or anorexia.